Hi everyone, Simon here from Life Naturopathics. I'm here with Cooper Fox from the Ozone Clinic up at Castle Hill.
That's me.
We are talking today about a fantastic new piece of equipment that I've got in the clinic called a ReOxy machine. This machine is extremely specialised. It works with oxygen in hyperoxygen and low oxygen environments. I'm not going to be able to explain it as well as Cooper can explain it, so we're going to ask him a few questions today. We're going to find out who's it good for, how long do you need to use it for, and if there's anything we need to be concerned about or anything like that. ReOxy, what is it?
ReOxy is intermittent hyperoxic and hypoxic training. Now, lots of people have heard of altitude training, which is intermittent hypoxic training, where it lowers the oxygen you breathe to increase the stamina of the body, so make it run on less oxygen. It also, this one has that extra H in it, has hyperoxic. So when you go for a run, you start puffing as you run, and when you stop, you take a period of time and continue to puff until your body's back to a normal equilibrium. This machine does that for you. So with the IH, it lowers the oxygen where you're breathing. So it lowers the concentration you're breathing per day, and as it comes down, you slowly lower your oxygen level and your cells start to struggle. And with this actually floods that oxygen, you start breathing again. And as those cells are struggling, it's sort of like not eating for a day and then going to an all-you-can-eat buffet. They're like, holy dooly, it's oxygen. So they literally stuff themselves overload. So that then lets the body have a quick burst of about 40 minutes of extra oxygen where it can start to help recovery. But after a period of about 6 to 7 sessions, that can actually start to be permanent. So instead of having a one-piece wonder where you've got that effect, you felt it after 40 minutes, and then 2 days later you're back to how you felt before, this can actually permanently start increasing the oxygen flow around the body. You're not going to have to do it every week for the rest of your life. This will make that permanent change to make that body more efficient. So each red blood cell will start to carry more oxygen on a day-to-day basis without trying. So that then means you're using a quarter less energy just to pump oxygen around your body, which means there's a quarter more energy to use anywhere else. So that may be for cognitive function, for study, that may be for inflammation in joints, that may be for general fatigue issues as well.
Is this machine, it's like climbing up a mountain. What happens to the body at high altitudes when there's less oxygen available, and how the body has to respond to that. When we're looking at low oxygen environment, the body isn't just going to shut down and give up. It's going to decide, how do I be more efficient with what I've got?
Efficiency is a big word you'll hear with ReOxy. It builds efficiency not only in oxygen transportation but in many other systems in the body. It's a beautiful machine to just tweak the body. It's sort of like a car. You've got a beautiful stock standard car. This is like chipping the engine, putting a bigger set of tyres. It makes it go faster, better, but better on fuel.
Is there a set of diseases or an umbrella of diseases where you feel as though this would benefit people the most? I'm thinking more of the chronic disease picture when people have seen a whole bunch of physicians. They maybe have, as we spoke off camera, we've got Lyme disease, we've got, anything like that. And we've got this body where, that we're a bit stuck in medicine at the moment. Would you think that's the kind of application for something like this?
We've done many studies on both in Australia and across the world. Is cardiovascular issues. If you're having aortic stenosis, anything hardening or build up within any of the main arteries and valves, this can help soften. So this was used by a specific cardiovascular surgeon or cardiothoracic surgeon in Germany to soften the aorta before he did any open heart surgery, as it made his job so much easier. And then we also look at it from a neurological point of view. The brain is very hard to work with. We can't, no matter how much of an athlete you are, you can perfect everything neck down, you can't work on the brain. It's not a muscle. It's not something as easy as that. What we can do when we increase oxygen flow is increase cognitive function, but also increase repair in the brain. So we look at things such as Parkinson's is a big one I deal with a lot in my clinic. This has been known, and we've done quite a few studies on Parkinson's as Alzheimer's, because what that is degeneration of certain parts of the brain, mainly from lack of oxygen. What we're doing here is we're increasing that oxygen flow, so therefore it's increasing the ability to regenerate what we're losing, or even just hold it where it is, stop the degeneration. General chronic fatigue. So I personally used to suffer from chronic fatigue chronic fatigue syndrome put on by a specific spirochete infection. In 1836, specialists in that time, and they just went, look, you're just tired, it's going to just be like that. I knew it wasn't right. I eventually found the clinic where I'm at now, and that's when they just had introduced ReOxy. So I did ReOxy as just a general health benefit, as well as many other treatments. This one I found particularly helped my sleep. I could relax overnight. My brain could finally get enough oxygen to just relax. I could shut off, I could sleep. My energy started increasing day by day. My sleep started getting less. I could survive then off of, 8 hours sleep a night, whereas I was doing 12 to 14 and still tired in the day. It increased sharpness, it can increase my study capacity. I used to be able to do maybe 1 paper a week, then I was up to doing 2, 3, up to 5 papers a week. What we're targeting here is the efficiency of the body. Again, that word efficiency. We're making the ability of oxygen transportation more efficient, so therefore the body can do it using less energy. We also use it for longevity, just for patients who 75, no major qualms, just want to keep themselves in a fighting fit shape, ready to play with the grandkids on the weekend.
Recapping, yes, we're looking at potentially people with chronic fatigue, chronic issues. Yep. Although we're certainly not saying we're curing Alzheimer's or Parkinson's and you mentioned spirochetes. Spirochetes are what happens when you have Lyme disease. So you'll see these little guys called spirochetes in the blood. We're not saying that it's curative, but I think anybody with any of this chronic disease, if you could offer them something different to say, hey, I think that we may be able to slow this down, we may be able to arrest it at very best. That's fantastic. As a naturopath in natural health, there's a lot of claims that can be made that might not always feel like they can be backed up with scientific data, but understanding that this machine is working with a very old information as far as we've known about hypoxia for a really long time.
Exactly.
We studied hypoxia for a really long time, and we can emulate hypoxia with something like this, and we can infer those results onto that machine.
We've sort of taken an ancient technique and turned it into a modern, safer design.
It's about 40 minutes,
Yep.
including, there's some testing, the machine will run you through a test. How will somebody feel? Is it something that people need to be set up for? Hey, you're going to feel a certain way. Do people feel anxious at all? How does that go?
There's always going to be nerves and anxiety there. For a first-time patient, particularly that first test, what the machine does is it works out where your limit is with hypoxia, works out how healthy the body is. It will feel like you're puffing. So when you go on a run, you go for 5, 10, 15 seconds and you start to feel that puff. It's sort of a light session like that. It's not as if you've just done a 10-mile triathlon. It's that light puffing stage. After your first or second treatment, that will become second nature. You will no longer recognize that you're puffing. You don't think about how you breathe. This is to retrain how you unconsciously breathe, not how you consciously do.
Gotcha.
So I always recommend distracting yourself, listening to a bit of music, meditating whilst you're there, anything that gets your mind away from the procedure. That's both from an anxiety and nerve point of view, as well as it will make the procedure just that little bit more effective.
It sounds almost too good to be true. I mean, we're only talking about oxygen or the lack of it, which is really amazing. What kind of stuff would an elite athlete, so I'm a big UFC fan, a lot of these guys like to travel to places to train at altitude to get those results.
Yes, and the Sydney Swans have just built a beautiful big hypoxic chamber where they're now training. So they're now on a treadmill in a massive pressurised room where they lower oxygen slowly, which is exactly what this machine does without that physical strain.
We can affect those athletes positively with what we're looking for from hypoxic training without really damaging their body or really depleting them. Would you say that most athletes or all athletes can get a bit of a bump or a bit of a bit of an advantage by using something like this?
Absolutely. Particularly swimmers absolutely adore this. They can then do more movements or strokes underwater with less breaths. So it can decrease their respiratory rate, as they call it, and more strokes, because your body has more oxygen sitting around within the entire cells. So then they can hold their breath more. A track runner or a football player, they can run further and do more because again they've got more oxygen to deal with. Their lungs and cells are so much more effective in actually getting a hold of that oxygen and putting it to the muscles.
Okay, thanks for your
No
time,
worries.
mate. See you
Thank
again.
you.
Cheers.